Chest reconstruction is a procedure that we perform to patients who identify as non-binary or transmasculine, or are interested in having their breast removed and to reconstruct a more masculine appearance of their chest.
And everything about this video is transphobic, according to the very standards set by the activists and allies of the trans community. Now, experts on gender ideology have told us that the concept is so simple that even 2-year-olds and 5-year-olds understand it, and it's such a shame that full-grown adults like myself don't. According to them, a man is someone who says he's a man, and a woman is someone who says he's a woman, and anything that suggests the contrary is bigoted and transphobic. Yet the craziest form of transphobia comes from these same people making this claim about the definition of a man and a woman, especially when they're advocating for gender-affirming medical procedure. And to buttress this point, here is a video from the Boston Children's Hospital that explains how the hospital is helping transgender children. And I want you to, spot the transphobia. Let's take a look.
Chest reconstruction is a procedure that we perform to patients who identify as non-binary or transmasculine, or are interested in having their breast removed and to reconstruct a more masculine appearance of their chest. Most of the times it includes a mastectomy, which is the medical term to describe a removal of the breast tissue, but also building a more masculine appearance to the chest, eliminating the inframammary fold, and reconstructing the nipples in a more masculine position and appearance.
So this smiley-faced doctor talks about, chest reconstruction surgery that gives trans and non-binary teenagers a more masculine appearance, right? And everything about this video is transphobic. According to the very standards set by the activists and allies of the trans community, it should be seen as transphobic. It should. And I'm going to point out 3 reasons why this is the case. First, I'm going to argue successfully that the doctor's use of the word masculine is deeply rooted in transphobia and should be triggering. Like, I'm shocked that nobody is triggered, because the word masculine itself means the quality and nature of the male sex. And according to the eloquent trans activists, as they have explained relentlessly, a trans man is not just a man, he's also a male individual, even though he was assigned female at birth by some bigoted, archaic doctor judging everything based on genitalia and body parts, right? So to put it in a simple, reasonable argument, a masculine chest, right, is a chest that belongs to a man or a male. And a man is anyone who says he's a man, including trans men. Therefore, a trans male has a masculine chest. And to suggest that his chest is not masculine is to say that he's not a male. And do I need to remind you what the trans experts have proven repeatedly, by repeating without unreasonable doubt that trans men are men? Do I need to remind you what it means? That anyone who suggests that these individuals are not men, or anything that suggests that these people are not men, is deeply rooted in transphobia, whether you call it logic, common sense, science, language, or medicine. So when this doctor says this surgery gives trans teenagers a more masculine appearance, he's suggesting that their chest is less masculine. He's being transphobic by using harmful, uninclusive language. He's re-echoing the homophobic claim that only women can have breasts, which according to the trans community is a far-right, outdated position, and it is hate speech and an act of violence. Women can be flat-chested. Men can have breasts. It doesn't matter what the physical appearance say. What matters is what the person thinks about themselves. That is what gender identity is all about. That is what the whole gender ideology brouhaha is all about. Secondly, not only is the language of this doctor transphobic, the medical procedure itself is deeply transphobic because it affirms the belief that we have already established as transphobic according to the doctrine of gender ideology, right? But it is even more transphobic because it suggests that trans and non-binary teenagers are sick. Yes. Else, why would he recommend for them a treatment procedure usually performed on cancer patients? Is he saying that their condition is such a chronic, deadly sickness? Though he didn't mention it, this procedure is often referred to as gender-affirming healthcare and life-saving medication. To put it in a simple, reasonable argument, this surgery is a necessary medical treatment and life-saving treatment, right? A treatment is a substance, preparation, or procedure used in treating a disease. So if this doctor is recommending this treatment for trans and non-binary teenagers, he is saying that something deadly and life-threatening is wrong with them because of their gender identity, right? He's implying that trans and non-binary teenagers have a disease, and their gender identity and gender expression to him requires such a serious medical intervention because it is a chronic illness. But again, according to the champions of the LGBTQIA plus community, this is hate speech. It's hateful, bigoted. That's a bigoted way of describing a trans individual. They are not sick or abnormal. They've always existed since the beginning of time. Since time immemorial, these people have been in existence. Some have even argued that historical figures like Jesus Christ and Joan of Arc were trans or non-binary. So to treat trans teenagers as abnormal or unhealthy is to stigmatize and dehumanize them. And that is clearly what this treatment is doing. It ignores the accepting and inclusive rewriting of history and reality by cutting off the healthy breasts of trans and non-binary youths as if their breast is unhealthy and abnormal. Thirdly, this video is from the Boston Children's Hospital. So this procedure is for children, and according to the LGBTQIA plus activists, these children need support and affirmation from healthcare providers, right? But this doctor is not affirming the identity and body image of these children through this procedure. This procedure suggests to children that their body is wrong, terrible, and worthy of mutilation. It subjects them to the gender binary, right? This very thing they are trying to dismantle. This gender identity that is determined by body part. It is subjecting them to that. It suggests that their breastless chest is what makes them a man. It even prescribes flat chests for non-binary teenagers. So until they have flat chests that look, buff or something close with breastless, until they have such, they are not men. And they cannot fully express themselves as men. It ignores, the fundamental gospel of gender ideology, which states that some women have penises and some men have vaginas. Some men have breasts and some women are flat-chested, right? That's why we have something like chest feeding and not breastfeeding, right? So to suggest anything contrary to young trans children is to inflict on them and on their bodies the highest form of hatred and bigotry. So my question is, why is the trans community okay with this? Why does everyone in this community support this happening to children? If these children are still trying to understand the doctrine of fluid gender identity, why is this heresy being advocated for and promoted? Because it is heresy to the doctrine of gender ideology. Where is the outrage? It looks like this religion tries to hold two opposing positions at the same time. It looks like it is both upholding and dismantling the traditional masculine identity, like the idea of masculinity according to tradition. It is upholding it and it is dismantling it at the same time. Like this minute a man can have a breast, and the next minute that same man may need to remove that breast to express his masculinity, even though he has always appeared masculine with his sexy breast. And anyone who looks at his beautiful breast and calls him a woman is a bigot, except when that person is telling him that he needs to cut off his breast to become a full-fleshed man, right? No wonder only children, those who are gullible and impressionable, and those who have stunted mental development, created by a deep love for absolute stupidity, those are the only people who find this nonsense reasonable and understand it. I guess it's because it is nonsensical, it is stupid, it requires no brain effort whatsoever to understand. Any person who dares to use their common sense will find this illogical and ridiculous. And that is why this nonsense is harmful, especially to children. It is deeply harmful to children, and they should not be exposed to something like this, especially not from their healthcare provider, not from those people. Alright guys, thank you so much for watching that video, and if you enjoyed the video, then hit the like button, share this video, subscribe to this channel, and ring that notification bell so you don't miss any of our subsequent videos. Also, as always, I want to know in the comments what you think about Boston Children's Hospital and their advocacy for chest reconstruction surgery. Do you think it is okay for children? Let me know what you think in the comments. And until the next video, peace.